Hello everyone. Today we will discuss a very important topic, cranial parasympathetic nervous system. So this diagram summarizes the entire cranial parasympathetic outflow. So there are four cranial parasympathetic ganglia: ciliary ganglion, pterygopalatine ganglion, submandibular ganglion, and the otic ganglion. And these are supplied by the mainly four cranial nerves: third cranial nerve, seventh cranial nerve, then the ninth cranial nerve, and the 10th cranial nerve. The 10th cranial vagus nerve, that is different because it does not synapse in named ganglia. Instead, it synapses in terminal ganglia located within or near the target organs. So let's work through the diagram from top to bottom. First is the oculomotor nerve, third nerve. So we can see the Edinger-Westphal nucleus in the midbrain. So this is parasympathetic nucleus of the oculomotor nerve, and the preganglionic fibers leave the midbrain through the cranial nerve third and travel to the ciliary ganglion. Here they synapse, and postganglionic fibers then pass through the short ciliary nerves to innervate the sphincter pupillae and ciliary muscle. Function is the pupillary constriction and accommodation. This is the path. This pathway forms the efferent pathway of the light reflex. And the clinical importance is a compressive third nerve palsy, especially from the posterior communicating um, artery aneurysm, typically affect the superficial parasympathetic fibers that lead to dilated pupil ptosis and ophthalmoplegia in sequence. So the usual question is why the pupil is involved in compressive lesions but spared in diabetic third nerve palsy, because in compressive lesions, when there is the it affects parasympathetic fibers which are in the periphery, so that is compressed first. That's why the pupil is dilated from the beginning. But in diabetic microvascular injury, it is there is central somatic fibers which are affected first, so the ophthalmoplegia occurs first. And now the facial nerve 7. So in this section of the diagram shows the fibers originating from the superior salivary nucleus, and the cranial 7 uh, seventh provide parasympathetic fibers to the three major targets: lacrimal gland, nasal and palatal glands, submandibular and sublingual glands. So this happens via uh, different pathways. So first is the for the seventh nerve, first pathway is the greater petrosal nerve pathway. Okay, so the preganglionic fibers leave this is the facial nerve which is coming out. But the preganglionic the greater petrosal nerve pathway, preganglionic fibers leave the facial nerve through the greater petrosal nerve, and they travel to the pterygopalatine ganglion. And the postganglionic the synapse happens at postganglionic fibers then distribute through the branches of the maxillary nerve, and the targets are lacrimal glands, nasal and palatal glands. And the clinical importance is lesions proximal to the genicular ganglion um, uh, uh, produce dry eye, nasal dryness, reduced lacrimation. This can happen. And so uh, and the next is the cauda tympani pathway. So this is cauda tympani. So what is cauda tympani pathway? The This is the second facial nerve parasympathetic pathway, and preganglionic fibers travel through the facial nerve, and then they through the cauda tympani they reach through the lingual nerve, they reach to this submandibular ganglion. They synapse here, and then the postganglionic fibers reach to the submandibular and sublingual gland. So clinical points: any middle ear surgery or temporal bone surgery can lead to injury to the chorda tympani that can reduce the salivation and alter taste sensation in the anterior two-thirds of the tongue. Next is the glossopharyngeal nerve. The next pathway originates from the from the inferior salivary nucleus. That's very important. Inferior salivary nucleus, that is in from the uh, ninth nerve. So that would be in the medulla. So midbrain, and then is the lower part of pons, and then this is the medulla. The preganglionic fibers travel through the glossopharyngeal nerve, and then through the tympanic nerve, go to tympanic plexus, and then through the lesser petrosal nerve, they reach to the aortic ganglion. Here the synapse and the postganglionic fiber travel via auriculotemporal auriculotemporal nerve to the parotid gland. Um, so next is the pathway is with the 10th nerve, the from the vagus nerve. Fibers originate from the dorsal motor nucleus of the vagus, and then the fibers go till the ganglia which are near or inside the final organs. Targets include heart, trachea, heart, pharynx, esophagus, stomach, large intestine, everything there. So the function included reduced heart rate, because this is parasympathetic, bronchoconstriction, increase gastrointestinal motility, and increase gastrointestinal secretion. So it will increase secretions and decrease heart rate. So these are the functions. This is all about the parasympathetic cranial nervous system.